A medical expert is calling on more mothers to break the stigma and get help if they're experiencing signs of postpartum depression. Shamela Pullen tells us more in the Health Report.
Postpartum depression is a type of mood disorder that happens during and around the time of childbirth.
So one of the first things you look for is the mother not willing to bond with or engage with the child. That's one of the earliest signs that you see. And that then leads to the cascading issue of feelings of sadness, feelings low energy, and not wanting to engage with the baby, not wanting to be able to do things. Then you have the changes in sleep. Either they're sleeping too much or they're not sleeping well. Constant crying, the emotional lability. These are things that are telltale signs.
Fathers too can experience symptoms of depression. After giving birth, most mothers go through a period known as baby blues, which should last for no more than 3 days. The psychiatrist says coping with the condition can be difficult, especially for persons who have never had depression symptoms in the past.
Some of the risk factors are first mothers, young mothers, or persons who had multiple children. You have psychological factors, persons who've had risk of depressive symptoms, or who have family members with mental health issues, and poor social support, either having conflict within the marital union or the partnership with regards to the child. And a lot of those things tend to be very, very straining.
If the symptoms persist for over a week, the mother needs to get help. Treatment is readily available in Jamaica, but many women avoid getting help because of stigma. If left untreated, though, it can lead to suicide.
We have psychiatric services attached to most, if not all, general hospitals and most primary health centers. We have psychologists specifically working in some of those areas in terms of Victoria Jubilee, I know, has a strong psychological department, university hospital as well. And there are psychologists that are working in some of the other regions that can actually provide the psychological support services.
With our health report, I'm Shamela Pullen wishing you good health.